So what is this? Identify this triangle. What is this triangle?
Inguinal canal. Colored? No, not
No.
colored.
It's not Cali.
Inguinal region.
No.
Hesselbach triangle.
Very good. It is known as the Hesselbach's triangle. Hesselbach's triangle. Very good. So see here, the anatomy part I am not covering about inguinal region. So, but just see, this is the inguinal ligament. It is the inguinal ligament. Here is the inferior epigastric vessel, inferior epigastric artery. Okay, and here is the lateral border of rectus muscle. Lateral border of rectus muscle. So 1, 2, and 3. They form the Hesselbach's triangle. So direct hernia will come through this triangle. Indirect hernia will come away from the triangle. Just remember those two things. Okay. Direct hernia will come through the Hesselbach's triangle, and indirect hernia will come away from the Hesselbach's triangle. Okay. So here is the deep ring. This is the deep ring. This is the superficial ring. So this is the deep ring. This is the superficial ring. So deep and superficial. Indirect hernia, it will come like this. It will go into the deep ring, go through the inguinal canal, and come outside. Whereas direct hernia will just force outside. Okay. So direct hernia will always come through the which triangle?
Hesselbach's triangle.
Hesselbach's triangle.
Hesselbach's triangle. Hesselbach's triangle is bounded by Hesselbach's triangle is bounded by
Inguinal ligament, inferior
ligament below,
epigastric artery, and lateral border of rectus.
lateral border of rectus, inguinal, epigastric vessels. Only 3. Okay. So, okay. Just guess what is this? Just guess.
Is it a pouch, sir?
Hernia. How will operate hernia? What are the operations for hernia?
Herniotomy.
Herniotomy. Just remove the hernia sac. That is herniotomy. Then
And patch.
hernioplasty.
Mental patch.
Yeah,
We have a mesh. We can place a mesh. That is hernioplasty.
Can we do PEG-C here?
No. This is
Okay.
laparoscopic repair of hernia. Laparoscopic repair of hernia. Okay. Just we have put the scopes here, and this is doing a laparoscopic repair. So in laparoscopy, there are some few fancy questions. So just I wanted to show you this one. So there is called a triangle of doom and triangle of pain. If you keep if we'll put a mesh and we fix the mesh. If you fix the mesh in these two triangles, the patient will, if you put it in the triangle of doom, there is lot of bleeding. If you put in the triangle of pain, the patient will experience lot of pain. Okay, these are two triangle of doom and triangle of pain. Just remember this. There are two triangles. One is the medial border is by gonadal vessels, iliopubic tract, and peritoneal reflection. Other is gonadal veins, vas deferens, and peritoneal reflection. Okay, just for understanding idea's sake, I'm telling, don't need to mark it up. Just Hesselbach's triangle is important. This I have a basic idea that there is a triangle of pain and triangle of doom inside. Okay.
Okay.
This corona mortis and all. I can This congenital diaphragmatic hernia. Congenital diaphragmatic hernia. This is very important from our MCQ point of view. Just pay attention here. Congenital diaphragmatic hernia. There are two types. I don't know. I have never seen a case of this, but so lot of questions will be asked in this. So just see. One is Bojidalic hernia. One is Morgagni hernia. Remember the names. This is Bojidalic hernia. It is most common congenital diaphragmatic hernia. So this is the abdomen. If this is the chest, contents in the abdomen go into the chest. Okay. Bosch-Dallek hernia, most common congenital diaphragmatic hernia, 90%. It is seen on the posterior lateral, mostly on the left side. Whereas Morgagni hernia, it is less common. It is anterior. It is on the anterior. It is posterior lateral. It is on the right side. So it is RAM, RAM. It is right anterior. That is Morgagni. It is LPL, left posterior lateral. Bosch-Dallek is left posterior lateral. Okay. These are congenital diaphragmatic hernias. Okay. Just remember these two names, even if it is difficult. Just remember. Morgagni is anterior and it is to the right side. Bosch-Dallek is left posterior lateral. Okay. So the contents are stomach, spleen, transverse colon are the contents in Bosch-Dallek hernia. Whereas in Morgagni, only the transverse colon. The abdomen contents are going into the thorax. Only the transverse colon will go there. Okay. Is it clear?
Yes, sir.
So it is just a congenital diaphragmatic hernia. Eccentric cyst is okay, not necessary. But this is important. Bosch-Dallek hernia and Morgagni hernia. Okay, hernia did not complete properly. So time is there. I think you will give me the list of topics which you have any doubts or anything like that. So once we can sit and it will take another 2 to 3 hours, we can complete these topics. Okay. Any doubts?
Oh, sir.
Yes.
Class over?
Yeah. If any
Okay,
doubts
sir.
are there.
No, sir.
Wow.
If
That's
we
over,
come
sir.
up with topics, then you would take an extra class for 2 hours.
Yeah.
Is that what you said?
Yeah.
Okay.
Whatever topics, if you have any doubts, you start reading now. Surgery, we will complete it more or less. Some 60 to 70% of topics are over. We can't complete 100%. You know that. So whatever topics are over and whatever topics are not over, also you just start revising it. If any questions are there, you just mark it on a paper. You can circulate in a group. Okay. Those questions you can send it to me, so that I can prepare for that and we can have a small session. Okay.
Fine, sir.
Yeah. Okay then. All the best for your exam.
Thank
And
you,
all
sir.
the best for your
Thank
future
you.
exams
Thank you
also.
so much, sir.
Thank you, sir.
Yeah, future exams also. So prepare in such a way that it will be covered for both the exams. Okay, don't prepare only for FM like that. Just whatever the topic is there, you prepare in total. Okay, so that the notes and all, if you write, it will be useful for your next exams also. Okay, that's what I tell all the students. Okay. Okay then.
sir.
See you. Any doubt is there, you can just message me anytime. Okay.
All right, sir. Thank you.
Thank you, sir.
Thank you.